Hi, my name is Taneesha. I'm here to ask a couple of questions and hopefully give you a diagnosis. Is that all right?
All right. Yeah, this is Dr. Mohammed speaking. So this is your patient. And this is the mother. She's going to be our informant. So the patient's name is Fatima, and Nesunanki. The mother's name is Faiza. So they are all happy to meet you.
Hmm?
So you can go ahead, please.
All right. Well, can I ask just I guess I'll just ask some general questions like how old you are and what are some of your favorite activities?
So me shekarunta nawa kuma wani wasa ta fi so. Eh, all right. So she's 5 years old and she loves playing with dolls.
All right. And then for the mother Faiza, what does she do for a living?
All right. So ke kina aiki ne? All right. So the mother is not gainfully employed. She's married. She's a full-time housewife.
Okay.
Yeah.
And does Fatima have any siblings?
Tana da kanwa ne, Fatima. Okay. So she has one junior sister. She has one sibling.
Okay.
Yeah.
And so what brings her in today?
So me yasa kuka zo da ita asibiti? Me ke damunta? Mhm. Ga me kuma da ni? Mhm. All right. So they came to the hospital because Fatima has fever, headache, body weakness, vomiting, and loose stools.
Okay. Sorry, what did you say after the weakness?
Um, vomiting and loose stool. That's diarrhea.
Okay, diarrhea too.
Yeah.
Okay, so can she tell me a little bit more about this fever? Has it been a constant fever or has it been coming and going?
So zazzabinta nan yana nan kullun ne ko yana zuwa ya tafi ya zo ya tafi. All right. She said the fever usually comes and go.
Okay, it's on and off.
Yeah.
And has Fatima had any loss of appetite?
So cin abincinta ya ragu ne. All right. That she has loss of appetite.
Okay, she does have a loss of appetite.
Yeah.
Has she experienced any sort of dizziness?
Okay. Tana jin kaman akwai jiri-jiri ne tattare da ita. Tana jin kaman jiri. All right. That there is no. She doesn't have dizziness.
Okay, that's good to hear.
Yeah.
So, what is her temperature right now?
Temperature taken is 37.8 degrees Celsius.
37.8. Okay.
All right.
All right. So she hasn't experienced any sort of shortness of breath, has she?
Tana ɗan jin numfashinta yana ɗan ɗaukewa ne, ko in ta ɗan yi wani ɗan tafiya ko ta ɗan yi wani abu haka sai numfashinta ya rinka ɗan ɗaukewa. Amma tana tari ko toshewan hanci. Akwai toshewan hanci. All right, that there is no shortness of breath and there is no nasal blockage, but she used to have some cough.
Okay, she has had some sort of cough.
Okay.
Well, hmm. So from the symptoms that I'm seeing, it looks like she might have a case of malaria, but just to be
Yeah.
sure, I would like to run a rapid diagnostics test to make sure. Is that okay?
Okay, that's good. Uh, rapid diagnostic test done for this patient revealed 2 pluses of malaria.
Okay.
Yeah.
All right. Well, is there any other symptoms yet that we have yet to cover, like any other sort of pain or any other digestion issues that I haven't looked at yet?
Akwai wani banda abubuwan da kuka faɗa akwai wani abu da kika manta baki faɗa ba wanda yake damunta. All right. She said there's no any other symptoms.
All right.
Yeah.
So Based on the tests that we've run so far, it seems like Fatima does have a moderate case of malaria. It's nothing too serious at this point, but we will have to treat her with some oral therapy and some anti-parasite medicines
Mhm.
such as Coartem or ACT. But it's nothing, it doesn't seem too, well, I'm sorry, I'm thinking how to word this. Just in case, could we also run a hemoglobin test since there is a chance it could be caused by anemia?
Good. Hemoglobin done for this patient is 6 grams per DL.
Oh, okay. So that is pretty severe.
Yeah.
And does she have any sort of pale skin or any sort of leg swelling?
Yeah, actually, you can look at her palms here. You see, they are pale. Look at the palms, they are pale. So the conjunctiva is also pale. Maybe you cannot see from there, but she's clinically pale.
Okay.
Yeah.
Okay, so it looks like in addition to the malaria, she does have a severe case of anemia. And
Yeah.
so that would require her to go through a blood transfusion with some iron-rich blood. Um, Hopefully, with the coartem, it should solve this. But I would like to talk to the mom for prevention in the future.
Okay. Go ahead, please. She's listening.
Sure. So, for Fatima in the future, to avoid this from happening again, I would suggest that she try to avoid getting bitten by mosquitoes, which might mean wearing some sort of mosquito repellent, wearing long sleeves, um, or even some sort of mosquito nets if you're able to get them to help keep mosquitoes as far away as possible. And then for the anemia in the future, I would say proper nutrition is the best thing you can do. So making sure that she's having a lot of meat, beans, green vegetables, fruits, and milk will be really good for her. Um,
Okay.
oh, yeah, you can tell her.
Wow, that's great, Tanisha. You have done great. And from the symptoms this patient presented with, you are able to suspect that this patient is having malaria. With and from your investigations, you suggested the correct investigations, rapid diagnostic testing, which confirms that yes, she has malaria. And because malaria normally gets complicated by anemia, so you also went ahead to check the hemoglobin level for this patient, which is 6, which is very severe anemia, even requiring blood transfusion. You can see your patient is already on blood transfusion. You can see the blood hanging out there. So thus that you have made the correct diagnosis for this patient, and for the treatment of the malaria, since she also developed anemia from the malaria. It's a complicated malaria, so we go. The treatment is IV artesunate. So also for the prevention, you mentioned the correct preventive methods for the malaria: wearing of long sleeves, use of mosquito treated nets. You were very correct there. And also treatment of the anemia, dietary modifications, vegetables, and the rest. You have said it correctly. So all in all, you have done very great, Tanisha. Congratulations.
Thank you. And I hope
Yeah.
Fatima feels better so that way she can play with dolls to her heart's content.
All right. So ta ce wai tana fatan ta samu sauki, ta samu ta ci gaba da wasa da bebinta. So the mother said they are very grateful too, and they are very happy that you guys are really helping them out. They are very grateful.
I'm happy to help, and I hope everything goes
Yeah.
well.
All right. That's very good. So congrats once more, Tanisha.
Well,
Yeah.
if you could thank them for giving me their time, I really appreciate it.
All right. So tana muku godiya again, tana kara muku godiya. So they said you are welcome, and they are also very grateful to you.
Thank you.
Yeah. So